Why do some people bite their nails? What could have been the cause of it? Is it a disease? Can it be cured? Watch until the end of the video to know all the answers. Hello, and welcome once again to another video of Health Revista. Thank you for all of the support. Continue to smash that like button or leave a comment, it will be great help to our growing channel. If you are new here, do consider subscribing and never miss our new updates. Nail biting, also known as onychophagia, or even erroneously onychophagia, is an oral compulsive habit. It is sometimes described as a parafunctional activity, the common use of the mouth for an activity other than speaking, eating, or drinking. Nail biting is very common, especially amongst children. 25 to 30% of kids bite nails. More pathological forms of nails biting are considered an impulse control disorder in the DSM-4R, and are classified under obsessive-compulsive and related disorders in the DSM-5. The ICD-10 classifies the practice as other specified behavioral and emotional disorders with onset usually occurring in childhood and adolescence. However, not all nail biting is pathological, and the difference between harmful obsession and normal behavior is not always clear. Nail biting usually leads to harmful effects to the fingers, like infections. These consequences are directly derived from the physical damage of biting or from the hands becoming an infection vector. Moreover, it can also have a social impact. The 10 fingernails are usually equally bitten to approximately the same degree. Biting nails can lead to broken skin on the cuticle. When cuticles are improperly removed, they are susceptible to microbial and viral infections. Saliva may then redden and infect the skin. In rare cases, fingernails may become severely deformed after years of nail biting due to the destruction of the nail bed. Nail biting may have an association with oral problems, such as gingivitis, and deformed teeth. It can also transfer pinworms or bacteria buried under the surface of the nail through to the mouth. If the bitten off nails are swallowed, stomach problems can occasionally develop. Nail biting can be a source of guilt and shame feelings in the nail biter, a reduced quality of life, and increased stigmatization in the inner family circles or at a more societal level. So how do we treat nail biting? The most common treatment, which is cheap and widely available, is to apply a clear, bitter-tasting nail polish to the nails. Normally denatonium benzoate, a well-known bittering agent. The bitter flavor discourages the nail biting habit. Behavioral therapy is beneficial when simpler measures are not effective. Habit reversal training, or HRT, which seeks to unlearn the habit of nail biting and possibly replace it with a more constructive habit, has shown its effectiveness versus placebo in children and adults. A study in children showed that results with HRT were superior to either no treatment at all or the manipulation of objects as an alternative behavior, which is another possible approach to treatment. In addition to HRT, stimulus control therapy is used to both identify and then eliminate the stimulus that frequently triggers biting urges. Other behavioral techniques that have been investigated with preliminary positive results are self-help techniques, such as decoupling, and the use of wristbands as non-removable reminders. More recently, technology companies have begun producing wearable devices and smartwatch applications that track the position of users' hands. Another treatment for chronic nail biters is the usage of a dental deterrent device that prevents the front teeth from damaging the nails and the surrounding cuticles. After about 2 months, the device leads to a full oppression of the nail biting urge. Evidence on the efficacy of drugs is very limited, and they are not routinely used. A small double-blind randomized clinical trial in children and adolescents indicated that N-acetylcysteine, a glutathione and glutamate emphasis, could, in the short term only, be more effective than placebo in decreasing the nail-biting behavior. Nail cosmetics can help to ameliorate nail-biting social effects. Independently of the method used, parental education is useful in the case of young nail biters to maximize the efficacy of the treatment programs, as some behaviors by the parents or other family members may be helping to perpetuate the problem. For example, punishments have been shown to be not better than placebo, and in some cases may even increase the nail biting frequency. This video is brought to you by Revista, where we make videos from everything and anything regarding our health.